This medication, Eliglustat Capsule, is used for long-term treatment of a certain rare genetic problem called Gaucher's disease. It works by decreasing the amount of a certain natural fatty substance called glucosylceramide, which builds up due to this condition. This can improve symptoms of Gaucher's disease, such as bruising, tiredness, pain in the joints and bones, and a swollen liver or spleen. The recommended daily dosage and the optimal timing of taking Eliglustat capsule should be discussed with a healthcare professional. Before you start taking Eliglustat, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once or twice daily. Swallow the capsules whole with water, and do not open, crush, or dissolve them before swallowing. If you are also using enzyme replacement treatment, you may take this medication 24 hours after your dose of the enzyme replacement treatment. Avoid eating grapefruit or drinking grapefruit juice while using this medication unless your doctor or pharmacist says it's safe to do so. Grapefruit can increase the chance of side effects with this medicine. The dosage is based on your medical condition, response to treatment, lab tests, and other medications you may be taking. Take this medication at the same times each day to get the most benefit from it. Tell your doctor if your condition does not improve or if it worsens. If you experience any of the following side effects while taking Eliglustat capsule, such as nausea, upset stomach, abdominal pain, gas/bloating, diarrhea, headache, back pain, arm/leg pain, dizziness, or weakness, make sure to inform your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Most people who take this medication do not experience serious side effects. However, seek immediate medical attention if you experience very serious side effects such as fast or irregular heartbeat, severe dizziness, fainting, or signs of a serious allergic reaction such as rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects not mentioned here, be sure to contact your doctor or pharmacist. Before taking Eliglustat, it's important to talk to your doctor or pharmacist about any allergies you may have, as this medication may contain ingredients that can cause allergic reactions. You should also discuss your medical history, especially if you have kidney or liver problems. It's important to be cautious when taking Eliglustat, as it may cause dizziness. Avoid alcohol or marijuana, as they can make you even dizzier. It's best to avoid driving or using machinery until you can do so safely. Limit your alcohol intake and talk to your doctor if you use marijuana. Eliglustat may also affect the rhythm of your heart, which can be serious. If you experience symptoms like fast or irregular heartbeat, severe dizziness, or fainting, seek medical attention right away. Be sure to inform your doctor of any other medications you are taking and any existing heart conditions, as they may increase the risk of these heart rhythm issues. Additionally, low levels of potassium or magnesium in your blood can further increase this risk. If you are planning to have surgery, be sure to inform your doctor or dentist about all the medications you are taking. If you are pregnant, only use this medication if it is absolutely necessary, and discuss the risks and benefits with your doctor. If you are breastfeeding, it is not recommended to use this medication, as it is unknown if it passes into breast milk and may pose a risk to the infant. Always consult your doctor before breastfeeding while using this medication. It's important to note that Eliglustat capsule may interact with other medications, which can affect how it works and increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Certain medications, such as azole antifungals, HIV protease inhibitors, macrolide antibiotics, rifamycins, paroxetine, ritonavir, St. John's wort, and drugs used to treat seizures, can affect the removal of Eliglustat from your body, which may impact how it works. Be sure to discuss any potential interactions with your healthcare provider. If someone takes too much Eliglustat capsule and experiences severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, while in Canada, residents can call a provincial poison control center. It's important not to share Eliglustat Capsule with others. Before starting this medication and while taking it, you may need to undergo lab and/or medical tests, such as a complete blood count, liver/spleen measurements, and a certain liver enzyme test called the CYP2D6 genotype. It's important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take your next dose at the usual time. Don't take extra to make up for the missed dose. It's important to store Eliglustat Capsule at room temperature, away from light and moisture. Remember not to keep it in the bathroom and always keep it out of reach of children and pets. When it's expired or you no longer need it, make sure to properly dispose of it as instructed by your pharmacist or local waste disposal company. Do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.